Hi, good afternoon. My name is Alden Bianchi. I'm the practice group leader of Mintz Levin's Employee Benefits and Executive Comp practice. I'm here to talk to you today about wrap documents. Why wrap documents and why now? One simple phrase, the Affordable Care Act. But you have to go back all the way to ERISA. So what's ERISA? And ERISA is a law that's been around since 1974, and it generally covers pension benefits and welfare benefits, including group health plans. From 1974 till about the Affordable Care Act, ERISA has required that plans have plan documents and that they be described in something called a summary plan description. This SPD, or summary plan description, is simply a document that tells employees in readable terms the general outline of their plan and what they're entitled to and how they access benefits. Before the Affordable Care Act, some folks didn't pay much attention to these requirements. There was, after all, no penalty for not having a plan document or not having a summary plan description. And other folks thought that the stuff they got from the insurance company was the plan document. It looked pretty good, glossy brochures and all, pretty pictures, looks good enough to them. But something changed, and that came along in 2010. And all of a sudden, for particularly large employers, they had to worry about making offers of group health plan coverage to their employees. And the bar got a lot higher because the penalties under the Affordable Care Act are pretty substantial. So they started to take a look around and dust off the wrap document concept. And a wrap document simply is taking the ERISA summary plan description and the plan document, smushing them together, putting them in one document, and referring to some other documents, might be insurance contracts or other items, and just reaching out and referring to them and incorporating them by reference. The concept has had some detractors, but for the most part, people have accepted the summary plan description, plan document wrapper as not a bad way to proceed. Now with the Affordable Care Act, the bar got higher in this important respect, is if you don't get the offers of coverage right, or you don't properly explain to employees what their rights are, then you're asking for trouble. And for those of you who are familiar with the requirements of the Affordable Care Act dealing with applicable large employers, you know, those penalties can run up to $2,000 annually for each full-time employee. So those numbers can get very big very fast. So I'd encourage you to give it a thought. At least reach out to counsel. Make sure that you're properly complying with both ERISA and the new Affordable Care Act requirements. If you're an employer, it's good for your bottom line. If you're someone who advises employers, it's good for your professional reputation.